Without further ado, it's my great pleasure to introduce the moderator of our next session. Gretchen Cook-Anderson is the Executive Director of LabCentral Ignite and an excellent partner of MassBioEd and the life science sector. We are excited to hear from her and from an amazing group of professionals this morning. And without further ado, Gretchen.
Thank you. Hello. I see lots of wonderful faces that I know. So good morning, everybody. Thank you, John. I want to thank John. I want to thank Sunny. Where's Sunny? Where did Sunny go? There she is back there. I want to thank Sunny Schwartz and the entire team at MassBioEd for inviting me to be part of this wonderful day. Look forward to sharing the platform today with some amazing colleagues who have done some wonderful work around vaccination outreach. And so to get us started, I thought that what I would do before I share a little bit about myself, to provide perhaps some personal context to why this work for me is so important. And I'm sure we all have our own personal stories and that fuel the work that we do and our passion for our work. In January of 2021, my aunt, who was also my best friend, passed away of stomach cancer. She did not survive. However, what gives me hope is that the innovator who will discover the life-saving therapies for people like her who had that rare form of stomach cancer may be soon a student to enter the biotech program that will launch at the Benjamin Franklin Institute. That might be a student from the community right here in Roxbury. Think about that. That's what drives me. That's what drives me. And I'm sure our panelists would probably have their own personal stories as well. So what I want to do is I want to cue up a video that I think will help to set the tone and help frame the conversation that we're going to have with our colleagues from Boston Medical Center. And so let's see, are we ready for our video? Go ahead and advance. Okay. Right here? All right. Here we go. Will it work? I know. Sorry, everybody. Let's see, should we advance one more time?
Excuse me, folks. Poor Gretchen. It's okay.
Boston's battle against COVID-19 has raged for over a year. The pandemic is still not over, but life-saving vaccines are here. All across the city of Boston, COVID vaccines are spreading hope.
The arrival of the first COVID-19 vaccines at Boston Medical Center was cause for celebration.
What I hope is that people will watch me today and join me in fighting this virus.
But with the vaccine rollout, we saw the potential for unequal distribution.
Statewide, Blacks and Latinos continue to lag behind whites in vaccination rates.
These shots are not reaching all of those who need it most.
We knew many patients would have significant barriers. We knew addressing those hurdles would require hard work, not just from BMC personnel, but also from community leaders and organizers. We knew we were up to the task.
We are working nonstop right now.
We are trying to reach out to people in our own community, to talk to people, to allay their fears, to give them facts.
Welcome to the dialogue of the COVID vaccination with the Cape-Verdean community leaders.
Es la misma tecnología que se usa para la vacuna de Ebola que previene Ebola y ha hecho que el Ebola no cruce para acá. Es lo mismo, pero para COVID.
About the COVID-19 vaccine.
So ask questions, engage with us. We're here for you. We've heard it all, and we want to hear more, so get your questions to us.
I think we need to do ongoing education. Black professionals like myself are goal is to not just be a hospital and expect people to come to you all the time, but going out to where people are.
We are very excited to establish the Hyde Park COVID-19 vaccination site at the Menino YMCA. This is a partnership for impact.
Hi, my name is Quincy Miller. I'm the president of Eastern Bank, and I just came to get my vaccination here at the Russell Auditorium.
Bishop John Borders is pastor of Morning Star Baptist Church. His church has partnered with Boston Medical Center to offer COVID vaccinations to community members.
We decided to get involved to show this collaboration between the church and the hospitals, science and faith.
A new vaccination clinic opened in Roxbury this morning. The 12th Baptist Church partnered with Boston Medical Center.
I am so thankful that BMC has led on engaging ministers, community leaders, and those who have a pulse on what's happening in our neighborhood to ensure that we are having the right conversations as it relates to the COVID-19 vaccine.
You can walk out of your door, out of your classroom, and then walk into a facility and get vaccines where you feel comfortable.
Now change is in the air, and a chance to get back to the things we love is right in front of us.
Nos ayons peuple qui doit social.
Las sonrisas para poder planificar juntos las cosas que nosotros queremos.
Getting the vaccine feels like I'm doing the right thing. The more of us that get vaccinated, the sooner we can get back to the things we love.
As Latinos, you have the responsibility to educate yourself. Un gran nivel de desinformación.
People will look like me, who are hesitant. Boston
Medical Center has been a champion of partnering with local-based community organizations, faith-based organizations, community health centers, and others to do outreach into communities of color and into those parts of Greater Boston that have been most disproportionately affected by COVID.
BMC is vaccinating nearly 4 times as many Black community members as compared to the state, and twice as many Latinx members.
And what I'm hoping is that COVID would remind us of the importance of public health and investing in public health.
We actually hope that this level of engagement, this type of engagement, doesn't end with the vaccine.
Very nice. At this stage, I want to invite my fellow panelists on up to join us at the front, if you would. And while they're doing that, I'll share a little bit more about myself. So as the inaugural executive director of LabCentral Ignite, we are the first, I wanted to share that we're the first and only of its kind platform in the life sciences that is dedicated 100% to addressing systemic, racial, and gender underrepresentation in the life sciences and biotechnology. We are based in Kendall Square over in Cambridge, but our work is in the community. Our work is in the community. And so speaking of community and the importance of community engagement, I'll also share that I have about a 28-year background in marketing, branding, lobbying, all these kinds of good things. But I say that to say that I understand the importance of public awareness, public engagement in this work that we're all doing in the life sciences to reach students, to reach an undertapped workforce. And so the question I want us to think about as we're all talking up here before we hand it over to you all for questions and before we engage later at our tables is how can we learn lessons, right? Let's think about the best practices from the Boston Medical Center's example and how can we emulate some of these practices in the life sciences. Okay, so I want us to think about that. All right, so as we get ready, we have a woman who, for me, it's a true honor. It's a true honor to be here with all 3 of these ladies. But Thea James, Dr. Thea James is someone who it's such an honor to be here with you. She is a legend. If you don't already know, now you do.
You have to be pretty old to be a legend.
I'm pretty old, I guess.
So Dr. James is Vice President of Mission and Associate Chief Medical Officer at Boston Medical Center. So we're going to let her share a little bit about herself, some things that she would like to share with you, and then our other colleagues will do the same, and then we're going to get going with our conversation. Dr. James.
Thank you so much, Gretchen. It is indeed an honor to be here today, and thank you everyone for being here. It's wonderful to see this standing room only room. This is quite great. As Gretchen said, I'm an emergency medicine physician by training. I'm Vice President of Mission, Associate Chief Medical Officer. I'm also co-executive director of the Health Equity Accelerator, and my role as Vice President of Mission is to coordinate and maximize BMC's relationships across a broad spectrum of industries and sectors, both regionally, locally, nationally. And the goal is to create upstream and innovative models of care to enable people to reach our patients and communities they come from, to reach their full potential, to have access and to reach their full potential and to thrive.
Good morning, everyone. It's great to see you all. We were all watching this video and we were tearing up. We were like, why are we so emotional? I'm Trina Martin Cherry. I am the Vice President of Community Engagement and External Affairs at BMC. And my job is basically to make sure I understand all of the work that's happening on our campus and connect that work to community-based organizations, community leaders, churches, community health centers, corporations, and state and local government, along with our government affairs team. And you saw a lot of the work that we did during COVID, and we'll talk a bit about that. I also work with Dr. James on our Health Equity Accelerator, making sure that we are developing community advisory boards so that all the work that we're doing at BMC has buy-in from the community. We've all heard Congresswoman Ayanna Pressley say, those closest to the pain should be closest to the power. So I am the community whisperer at BMC, and I'm really looking forward to having this conversation with you all.
Oh. Hi, I'm Lily Vautour, also really happy to be here. I'm the Director of Brand Engagement at Boston Medical Center. I sit within the Marketing Communications Department, largely focused on our social media program and growing and kind of redefining our marketing program. I think hopefully you saw a lot of interesting social posts and videos and other things that are much more representative, I think, of what we've done in years past. So we learned so much throughout this campaign that we're moving forward and applying to all marketing aspects at Boston Medical Center. So it's been an honor to work for this amazing hospital. Like Trina, I also got a little emotional rewatching all of that again, remembering just how many partners we work with, how committed all of our partners, physicians, nurses, social workers, community engagement team members are invested in helping to serve our communities. So excited to have this discussion.
Thank you. Thank you so much. So our first question is to Dr. James. And I want to share, so I'm going to call you Dr. James. I grew up in the South. So you're lucky I don't say ma'am, but this is what we do, ma'am and sir. So, but Dr. James, what was Boston Medical Center's approach to creating public awareness in response to the need to activate COVID vaccinations, particularly among communities of color that have been disproportionately affected by the virus?
I think the answer, one word answer to that question, which is also, I would say, the theme of what we're talking about right now, is intentionality. Intentionality. Because like Bob said, none of the data he showed is not new. I'd be surprised if there's anybody in this room who would say they were even surprised. Because no matter what topic you're talking about, if you measure it by demographics, you already know who's going to do worse. And the thing about that is it's not organic. That's not organic. That was sort of, created. There are a lot of structural things policies and things that created those data to perpetuate that way decade after decade. And so, but again, it's intentionality. Because just like that was created, which mainly prevented access for folks, you can do the alternative to that. And I think what we'll discuss today, and Trina will get deeper into it, was intentionality to do the alternative. And so everyone in the city knows, or in the state, or in this room knows, in Massachusetts, which populations fared worse during COVID. But when the vaccines came online, that's not where they were deployed. And honestly, that's public health 101. I mean, when there's a disease or some sort of issue going on that affects health, that's where the target is. But that didn't happen. And I would say, that's when people talk about equity and inequity, the problem with inequity is that it is largely invisible because it's so much the status quo that it appears normal and you don't recognize it. So those communities aren't generally targeted or intentionally targeted to or prioritized is the word. They're not prioritized. So even in a public health situation, they still were not prioritized. So BMC, those were our patients. We were the first hospital to topple, during COVID. I wish you could see the data every day, the bar would go up. So long story short, we knew we had to do something. And so we essentially knew we had two problems. We had surveyed the community to see what their pulse was on the vaccine. And as you might expect, the majority of people of color were saying they didn't trust the vaccine and they were not going to get it. But then we realized that, our employees also come from the same communities. And when we looked internally doing the same surveying, only 36% of Black and brown employees said they would take the vaccine. Only 36%. And so we knew we had a problem. We had a problem of access, but also of hesitation. And so we created things an approach to address both of those things. So I think Lily will also maybe talk about the internal stuff we did. And Trina will talk about external stuff we did. But, essentially, we had all these Zooms and things, and some of them you saw in the video where Trina had set up all these Zooms with community leaders. And we and people at BMC, and we had two goals for those Zooms, multiple Zooms. One was to provide answers and education around the vaccine for people on the calls. And the other thing was to ask them, how should we address this access problem? Where should these vaccine sites be? What should they look like? What should they feel like? They've worked hand in hand with our operations team, strategy people, walking together out in the communities, doing site walkthroughs and visits like that. And so it was really a community and institutional partnership. So that's at a high level where we started this process.
Thank you very much, Dr. James. And you mentioned a really critical word, trust, right? And I think that what we're finding too, that even in the life sciences, in trying to engage and inspire more folks from historically disconnected communities to consider careers in the life sciences, there's a trust issue there as well. There's a need to demystify the life sciences. What's exactly going on in those buildings with all those labs, right? And so speaking of community and trust, Trina, how important has it been to mindfully build and nurture intentional relationships in the community to instill trust and drive vaccination rates in communities of color? And what kinds of community relationships have been the most critical in establishing trust and fostering awareness?
Yeah. So trust came definitely with intentionality, creating access, like making sure that we had the vaccines to take into the community. Thea mentioned that we looked at the data. We were looking at SBI data to see where in the communities, where were people sick and dying the most. And so once we knew the location, and it was the obvious, it was the Roxbury, Mattapan, Hyde Park, all of those areas, we were like, okay, where are the places in those communities where we can create trust? And so we got on the phone, we went out into the community, we talked to churches and YMCAs and Boys and Girls Clubs. And the sites that we set up were places where we knew people were comfortable going. Reverend Willie Bodrick at 12th Baptist Church, not only did he give us a site, but he became one of our advocates. When he got vaccinated, we came in there with a camera and filmed it and got sound bites from him that we could, put on TV and that he could put in his congregation over their virtual services. So we knew that in order to educate folks about the vaccine, get them to the place where they were comfortable enough to get the vaccine, it had to be based on trust. So it was, you saw the McCourty twins. So across the range, we were in a room. It was one of the amazing things about BMC is that we were able to do these things like on a dime. At a table, you had marketing, you had facilities, you had clinical, you had, community engagement, everybody at the table with set on intentionality with how we can get it done and get it done really quickly. Those sites went up in overnight. Overnight, we were able basically to create the sites, but then have folks come on a Zoom where we had a panel of doctors who looked like them. If we were talking to the Haitian community, we made sure that we had Haitian doctors and nurses on the panel, giving information in Haitian Creole, in Spanish, in Cape Verdean. So it was an exercise in making sure that whatever we were doing, we were answering people's questions. We were making sure that we had advocates in the community that they could trust, and it was just constant. But we learned a lot through the community conversations that we were having, creating spaces for healthcare in communities outside of our campus. We found that the success that we had with the vaccine, and you guys saw it, I think we vaccinated 5 times the number of Black residents of Massachusetts and 1.5 times the number of Latinx community members in Massachusetts. We learned that those methods work. So what worked for the vaccine works for diabetes, it works for mental health, it works for heart disease, it works for maternal child health. And so we're using those same tactics, that same level of trust that we built to tackle other healthcare issues. One last thing that I'll add is that Thea and I both sat on the mayor's task force for COVID-19. And so we were already at the table with Boston Public Health Commission, with other hospitals. And whenever we could develop a coalition of folks and corporations and organizations to work together, that's what we did.
Thank you, Trina. So again, the question that I asked of you all at the top, right? How do we take lessons from what they did and apply to workforce development and workforce diversity in the life sciences? That community piece is essential. So for those who, I know we've got some wonderful industry representatives here today. So for industry, that might mean that it's not enough to just post a job description on your website, right? Or it's not enough to just have your HR consultant put posts up on LinkedIn, right? But there's a community engagement element if you are really trying to reach populations of professionals who you have not historically had strong connections with. So thank you very much, Trina. I am going to sit down at this 4th seat. I had knee surgery in January, so I'm just going to admit that to everybody, and I'm just going to creep over here before my leg gives out on me. Okay. I was trying, y'all, to stand. I really was, but okay. So now I want to go to you, Lily, if you wouldn't mind. Beyond creating community connections, what are other elements of a powerful, effective public awareness campaign in the public health sector, and what pivotal questions fuel the planning of initiatives like these?
That's a good question. So I think with this campaign specifically, we had such a strong foundation from what you heard from Trina and Thea on the ground, those trusted relationships that didn't come overnight. Those were long-standing and allowed us to launch a campaign, from a really stable ground. And that took a lot of time. I think building Boston Medical Center's social media channels, we were in the same boat of, we'd been working for a while to ensure that we had proper representation of our employees, and we were showcasing all different job types and individuals, working on our patient story program. But having those things doesn't happen overnight. And so I think kind of applying to this life sciences and recruitment efforts, really looking at how your organization is representing themselves, I think online, digitally, is really important to support what's happening on the ground. And I think that's what we were able to do is strategize. Like Trina said, we had all the facilities people, strategists, planners, and marketing got a seat at the table too, to really hear how the sites are being developed, how we could properly communicate them in culturally sensitive ways in the right languages to reach the right populations. And that was new for me. It was new for our team of really taking that time and investing those resources and not just sharing, a social media post of like, come visit 12th Baptist Church for the vaccination, but interviewing who runs the church and hearing from them why it's important, and then translating that material into the right languages to reach the right folks. So that's kind of how we built the campaign with that intentionality, like Thea and Trina mentioned, that needs to match what you're doing on the ground and externally. So I would kind of challenge all of you to look at your organizations and who your social platforms, just as one channel example, who are they promoting? Are they going inside the lab and showing an inside scoop of what it's like with somebody, from a background that you're looking to recruit from as well? Doing storytelling has helped us quite a bit, and I think helped a lot throughout this campaign. We weren't shying away from also the hesitancy, like we were putting that first in a lot of cases, especially early on. Interviewing employees, like Thea mentioned, we had a really low initial uptake on vaccination. There was a lot of hesitancy, and we chose not to shy away from that, but really highlight that and use that to fuel kind of how we were talking about hesitancy internally too. So Thea mentioned that. We did a ton of work within our own four walls before we were able to go out and have those advocates sharing, I was initially hesitant. Here was why. Here's what helped me get over it. Not that everybody's story is going to be the same, but everybody's coming from a different background. Trying to be real with people, and be really honest. So I'm not sure if I totally answered that question, but that was kind of my initial take here. That's
Thank you, Lily. Yes, you did.
Okay.
Thank you. So speaking of workforce, because, a lot of this focus today is about life sciences workforce and how do we inspire and cultivate a more diverse life sciences workforce. I do want to ask you all a question about the workforce at Boston Medical Center. So major hospital centers like yours have ongoing workforce needs and serve a diverse patient base, and I think we all know that. According to your 2021 Together at BMCHS DEI year in review, an estimated 52% of Boston Medical Center's workforce identifies as persons of color. What tangible elements, because I think you're all doing pretty well, what tangible elements are key to Boston Medical Center's approach to maintaining a highly diverse workforce that could be emulated by the life sciences?
I think it's very similar to what we've described so far. The only thing we didn't mention so far is that we do it internally, but we also partner with people externally. We partner with people who actually train the employees for the jobs that we need. So we partner with them, funding them, to train people, which I think is something you could really also do for the life sciences. To partner with entities within the communities that you're tapping into, who are training these people in this population we're trying to recruit. There are entities within the community, who are training them, funding those institutions, and partnering with those people to and cultivating relationships to sort. It's not like planting a seed and it will grow. And again, it's a simple thing, but the mindset is what's the hardest to change. I think the whole everything is mindset. We're just not, I don't know, not used to doing a lot of the things that we've been doing, but just intentionality. I really strongly believe that this can happen. This can definitely happen. I can't think of any reason why this can't happen with intentionality. So that's how we've done it at BMC. And they focus a lot on employee providing them once they get into nurturing. They have these programs within the hospital that are not just bringing people into a job, but also with intentionality, giving them the right sorts of resources and attention to rise through the ranks of the organization. And a lot of this we did by looking inside ourselves internally first to see what the gaps were, and being intentional about closing those gaps.
I think I'll just add to that. We are always looking to build relationships. Thea and I just this week met with our head of HR and the president of BFIT, where we were like, okay, what's new? What do you guys have going on, and how can we connect our employees and the community with what you have going on? If you are intentional, things and opportunities will find you. I walked in the door to this conference. I ran into my friend Vautour. We started having a conversation. I ran into my friend Corey Vautour from LaSalle, and we were talking about, BMC really wants to build this pipeline of talent to create jobs for the community. And now we all have a meeting set up. Like, what are you doing at American City Coalition? Thank you. What are you doing at LaSalle? This is what we're doing. These are ways that we can work together to create real opportunities for people. And so if you say that we want to, be intentional about building a biotech pipeline, then let's all have a conversation. Find other people who are doing it to figure out what steps need to be taken to make sure it gets done.
Thank you so much. It sounds to me like our solutions are right here in this room today. Industry, educators, all the folks from STEM nonprofits and training centers, you all are the solution to this problem, right? In many ways. And so hopefully you'll take opportunities to connect with folks who you don't know today and find that there may be some possibilities of strategic alliances. And particularly when you think about public awareness, how can you work together to foster greater public awareness? So thank you very much. I think we might have a couple minutes to take a few questions from the audience. Right? I think we've got some time. Oh, I'm sorry. Yes, Lily would like to add, and then we'll take a couple of questions.
Just from my kind of narrow communications lane with this, but what we really tried to do, which I mentioned a little bit on BMC social and digital channels, is also highlight our employees and celebrate them and recognize them. And I think we should all be looking at your digital channels as vehicles for recruitment. The young generation, for better or for worse, is growing up on TikTok and social media. Are your organizations using those channels, and are they using them effectively? Because if they're not, you're kind of behind. You got to kind of keep up with the times and keep up with the growing generations. It's a constant challenge for my team of just staying up to date with the latest technology, but I think there's a lot to explore in that space, and to just kind of get started somewhere, I think would make an impact. So I just wanted to share that quick anecdote just from a kind of comms perspective.
Thank you. That's very helpful. Thank you, Lily. Okay, so let's see. Are there any questions that anybody might like to ask? Additional details you'd like to know about the work that Boston Medical Center has done? Yes.
Really, you basically, the way I interpret this, you save lives. So I'm curious, have you been approached by any national organizations or publications to kind of put this in writing, what you've done, and share it even more broadly outside of Massachusetts? Because I think it's phenomenal.
Good timing.
Less than 8% of less than 8% of articles presented to Annals of Internal Medicine are accepted for publication, and we just had one on this very thing we're talking about right now. It just came out.
All right, thank you. Any other questions? And if you would, before you ask your question, if you could just say your name and your affiliation, that would be really helpful for everyone to know who's in the room. Thank you. Right here with the glasses on.
I'm I'm interested to know about your employee resource groups. Do you have employee resource groups within BMC, sort of communities of teams of individuals? And if you do, did they kind of coalition together in this effort? And what role did they play or do they play in some of your community work?
We do have an employee resource group, and they're mainly employees of color, to be honest with you. And I honestly don't know if we tapped into them for this work. I'm not sure. So I can answer half of the question. You know, they're generally available, you know, as a resource for many things, but I'm not sure we tapped into them for this work.
One thing we did do, we had a number of panel discussions and community conversations, and I know a couple of those were sponsored by one of our diversity groups. So what we did post George Floyd and during COVID was to make sure that we were educating our staff and our team. So we brought in speakers to talk about diversity and inclusion and systemic racism especially. So I know that's one thing.
I think we may have time for one more before we go into our table discussion.
Sure. Thank you all for sharing. I'm Sarah McDonald from Life Science Cares. I'm curious, as we think about translating your success into our future success, how you thought about balancing engaging your employees of color, but also not making it invisible labor, right? One more job that the people of color in your organizations need to do. And then how did you empower those of us who aren't minorities to be as supportive, as effective in this community building and engagement work that you did?
I took this, but now I think I should give it back because I was really going to talk about missions, and I was like, I just took it from the chief of missions to talk about missions. So I think the employees who work at BMC, they come to BMC because they understand our mission, exceptional care without exception. And so when we are doing work in the community, and I stress that all the time, I was like, we can't serve the community if we don't know the community. So I encourage people to get in the community. If we're having some sort of event, make sure that you show up. So I think it's less of asking them to do extra work. I think they know that this is what I signed up for. And for me to be more effective in a clinical space, I need to understand the community that we serve. So I hope that answers your question.
Thank you, Trina. Trina, deputy of mission. There you go. All right. And thank you, Sarah. Life Science Cares right here in the front. And so what we're going to do, we're going to wind down and start segueing over to our table discussions. But before we do, I did want to mention there is an opportunity for those of us in the life sciences, educators, STEM education nonprofits, training organizations, industry. We actually have our own opportunity that's coming up, and well, it's actually in planning right now to tap into with regard to a public awareness campaign that is being designed uniquely for biotech workforce diversity. So I'm proud to say that our organization is kind of taking the lead. We're partnering with a number of other organizations, including Mass Bio Ed and Mass Bio and Massachusetts Life Science Center and others. But we are going to be launching in September a public awareness campaign pilot in the communities of Roxbury, Dorchester, and Lowell. And those communities were chosen with intentionality, thinking of that word intentionality. It'll be a 6-month pilot. It is a full-on ad campaign, social media campaign, video. There's video elements. There's a microsite. There's an actual resource landing page. So all of the ads that people will find on the MBTA and out-of-home billboards and on the trains and so forth, there will be QR codes where anyone who is interested can then patch directly into that resource landing page, where they will find both lots of storytelling about people who look like folks in the community who have been successful in navigating into the industry across the spectrum of roles, both science-based roles and non-science-based roles. And so there'll be storytelling, all the information that they'd like to be able to tap into if they're interested in further education, in training, and in real jobs that are available right now in the industry. So did want to tell you that. If anyone is interested, I'm happy to chat with you more, or you can reach out to us on our website. But we have an opportunity that's right here, right now, that will be launching in September. So we're interested in all partners. This is an all hands on deck opportunity. And so we are inviting everyone to reach out and be part of this so that we can perhaps do what they've done at the Boston Medical Center. So, but we're emulating a lot of those same lessons learned, a lot of those same best practices. And there's also a community engagement element too, with a series of workshops called What the Heck is Biotech, right? And Mass BioEd is also involved in this too as a partner in the series of workshops. So with regard to the workshops, with regard to the ad campaign, if you are interested in being part of this, please, 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 all hands on deck. But thank you very much. I am going to pass the floor back over to John for our next segment.